you're tuning in through the live webinar, you can email me, winn.50@osu.edu, and I can ask those questions for you. Today's Lunch and Learn's title is Preserve Your Heart and Brain Health, Evidence-Based Strategies That Work. Our speaker today is none other than Dr. Bernadette Melnyk. She is the Vice President for Health Promotion, University Chief Wellness Officer, and Dean of the College of Nursing here at Ohio State. Please help me welcome Dr. Melnyk.
OH, I am not living proof of a chief wellness officer today. My husband has been super sick for 2 weeks, and I was bragging that my immune system is so good that I haven't gotten ill, and then Tuesday night, bam. So I actually was out the last 2 days, but I had to come here today because I have some major things going on. But because we still have people coming in, I thought I would tell a joke because humor is good for our heart and our health. So, how many of you are parents in the room with kids? So most of you. So imagine this. You're the parent of 2 little twin boys. One's an extreme optimist, looks at the world through rose-colored glasses, a lot like I do. The other twin is an extreme pessimist. Nothing is right. Nobody's good. He just grumbles throughout every single day. Well, his parents, he was driving them crazy because they were optimists. So they were saying, what can we do to change this little boy's personality? So they started going to their pediatrician, tried to get advice from him. Didn't like that advice. Went to the nurse practitioner. Really didn't care for that advice. Then they end up at a psychologist's office. And the psychologist said, I have a cure. If you really want to change the pessimist twin into an optimist, what I want you to do on the twins' 8th birthday is bring in every toy and game that little pessimist could ever wish for. And they said, okay, I kind of see the logic in that advice, but what do I do for my optimistic twin that day? The psychologist says, I want you to bring in a huge crate full of manure for him. They're like, what? That's crazy. He said, you want to cure the pessimist? You got to do as I say. So on the twins' 8th birthday, the parents did as they were instructed. They went and peeked into the little pessimist room. They had all these beautiful wrapped presents. The little boy was sitting among them, ripping off this beautiful wrapping paper, complaining about every single one. I didn't want Monopoly. I wanted Junior Scrabble. I didn't want a red fire truck. I wanted a yellow one. And the parents shook their head and said, this little boy is never going to change this pessimistic personality. So then they went and peeked into the Optimist twins' room. This little boy was on top of this huge crate full of manure, digging through it furiously, saying, "Where there's manure, there's got to be a pony." And I love that because that little boy, the optimist, and if you're blessed with an optimistic personality, guess what? You're going to have less depression, less anxiety, and therefore healthier hearts and healthier brains. Now, we did this webinar. It was a national online webinar with the National Forum for Heart Disease and Stroke Prevention, with the National Institute for Neurological Disorders and Stroke a few months ago, with this similar title: Preserve Your Heart and Your Brain Health. Because most people do not connect heart health with brain health. And today, that's what I'm really going to be emphasizing. The really good news about linking the two, the behaviors that are going to help one will simultaneously help the other. So, a couple of facts. At an average rate of 80 beats a minute, the heart beats 115 times, 1,000 times in one day, or 42 million times a year. Don't you think that is a big reason to take care of our hearts? Think about that. 3 billion times a year our hearts are going to beat throughout a lifetime. So, how many of you have tried to change the behavior of somebody you love? And you laugh as I say that because you know where I'm going with that, right? Do people usually change with facts? No, I'm going to stand here today, and I'm going to share a lot of striking evidence with you that should be enough to get people to change behavior. But bottom line is, facts alone aren't good enough to get people to change. I always tell emotional stories because it's emotion that gets people to change their behavior. When do most people change? Sadly, crisis happens, right? Maybe they lose a sibling who wouldn't follow a treatment plan, exercise, whatever it is. And they say, you know what? I got to start doing more things to take better self-care. So how many of you know where Republic, Pennsylvania is? Anybody ever heard of it? Is anybody from Pittsburgh in this room? I grew up here, a small little coal mining town an hour south of Pittsburgh, near the West Virginia border. My dad was a coal miner. I lived in half of a little house. The whole thing was probably 900 square feet. We were probably labeled working poor. But you know what? I was born with rose-colored glasses on, like that one little optimistic twin. I still think heaven can make lemonade out of lemons any day. That optimistic, resilient personality came in handy for me on a cold January day when I was 15 years of age. I just had a best friend over for a sleepover. My mom got up the next morning, made us a big breakfast, laughed, joked around with us. My best friend left. My dad left to go do a shift in the mine. My mom sits down on our couch to pay bills. And I say, I'm going to go upstairs to grab my things to take a shower. My mom says, okay, Bern. I start walking up the stairs. My mom sneezed. I said, bless you, Mom. She didn't answer me. I said, Mom, bless you. She didn't answer me. I thought that was odd. So I turned around, walked down the stairs to find my mom's head back on the couch. She was already unconscious. I shook her. Mom, what's wrong with you? She fell over and died from a stroke right in front of me that morning. Now, I suffered from terrible post-traumatic stress disorder. After 4 months, not sleeping through the night, waking up with nightmares, jumping every time somebody sneezed, worrying like crazy that I was going to lose my dad because I lost my mom and I would be an orphan. So after 4 months of this, I was taken to my family physician, and my cousin said, please do something to help Bern. And do you know what that provider did today? As so many do. Got out the prescription pad, wrote a script for Valium, and said, give Bern one of these every night. She'll sleep and be just fine. And I remember taking one that night, but I woke up the next morning groggy, and I didn't like how I felt. I said, I don't want to keep taking these. I just got to gut it up and cope. There was no evidence-based cognitive behavior therapy for me back in Republic, Pennsylvania. There was nothing. But sadly, think about this today. We're in 2020. 1 out of 5 children, teens, adults have a mental health problem, yet less than 25% get any treatment. And if they get treatment, it's usually not gold standard cognitive behavior therapy, which we know is the best treatment for depression and anxiety. So here's the saddest part of my mom's story. She had a history of headaches for over a year. And my dad kept saying, please go to the doctor, figure out what's wrong. She went to her family physician 1 week before she died. Her diagnosis, high blood pressure. Given a prescription for a blood pressure medication that my dad found in her purse after she died. She never took it. Do you realize 1 out of 2 people in Ohio, throughout the United States, who have high blood pressure don't have it under control? My dad then had his massive heart attack when I was 19. I have terrible cardiac genes. How many of you have bad genes that were handed down? I want to tell you, and I'll show you some evidence in just a little bit. It's okay. We all have genes that we inherited. But believe it or not, our behaviors weigh in heavier to determine if we're going to die prematurely or not. Now I think you understand why I left sunny Arizona 8 years ago to come to Buckeye Nation as Ohio State's first Chief Wellness Officer, because I am so passionate about wellness and particularly prevention and what we can do to build the best wellness culture that we can build here at Ohio State, because we care about each and every one of our family members and want you to lead a healthy, productive, happy, engaged life. I want everybody to jump out of bed on a Monday morning and say, "It's Monday. I'm so excited. I get to go to work in Buckeye Nation today." That's the kind of culture I need your help in building. I'm a big dreamer, but I'm also a fast action person. And I do believe we can build that type of culture. So, heart disease, number one killer. Think about this. 1 out of 31 women, because we have a lot of women in this room today, die from breast cancer. But 1 out of 3 women die from heart disease. But what tends to get most of the PR? It's breast cancer. Yes, we have Valentine's Day, Go Red for Women, all of that. But when you think about that statistic, 1 out of 3 people, men and women, dying from heart disease, it's mind-boggling. Even more so because 80% of heart disease, strokes, heart attacks can be prevented. The average American doesn't think we can prevent stroke. We know that from national data, studies that have been done. We also know women present very differently than men if they're having a heart attack. Men often experience crushing chest pain, right? That radiates to the arm, nausea, sweating. A lot of women do not have those classic signs. They might have difficulty breathing. Maybe they'll have jaw pain. Maybe they're doing some sweating. Maybe they'll feel like they have the flu. So those symptoms often confuse providers when they see women in the emergency room. And that's why you've got to advocate for yourself. Do you know preventable medical errors today are the third leading cause of death in America? Think about that. Heart disease, number 1. Cancer, number 2. Preventable medical errors, number 3. About 400,000 people we lose every year from preventable medical errors. And I know it sounds cynical, but it's true. If you want to up your chance of dying today, get yourself admitted to a hospital. I mean, how sad is that? But think about that. That's why I always say if you or a loved one is in the ED or you're in the hospital and you can't advocate strongly for yourself, you need somebody with you. And a lot of those errors are caused by the most well meaning clinicians who are totally burnt out. 50% of physicians, nurses, pharmacists are suffering from burnout. So, what do you think the chance of a burnt out provider is to make a medical error? And sadly, a lot of that burnout is caused by a lot of problems in our healthcare system. Now, if you have not heard of the National Academy of Medicine's Action Collaborative on clinician well-being and resilience, I'd encourage you to check it out. Google it. We've got a fabulous website with a knowledge hub with a lot of great information. I'm privileged to serve as one of 62 leaders on that national initiative, working hard to reduce clinician burnout. Women wait an average of 54 hours with their symptoms before they finally go in and decide something should be done about it. But remember, the earlier you go, the more you stack your odds of being able to be helped if indeed heart blockage is going on. So heart disease kills more women than all cancers combined. And then let's take a look at stroke. These statistics are mind-boggling. Almost 7 million Americans have had a stroke. There's almost 1 million new strokes every single year. But the leading risk factor for stroke is blood pressure, high blood pressure. That's why the guidelines were so tightened up on last year. We want everybody's blood pressure, if we can get them there, below 120 over 80. That was a change from prior guidelines because of this new evidence showing high blood pressure. It's the most treatable preventive factor to decrease people's risk of stroke. Silent or subclinical strokes occur in about 28% of older adults, and they affect adversely our white matter within the brain, which leads to dementia. So again, I can't beat the issue enough that if you have high blood pressure, it's really critical to have great control of it, because 1 out of 2 people with hypertension do not. White matter lesions in the brain can be seen in 40 to 80% of older adults, and they are associated with high blood pressure and cognitive decline. So again, this whole integration of heart health with brain health is super important. So every 40 seconds, somebody in the United States has a stroke. And as I already mentioned, up to 80% of strokes are preventable. They're preventable. So we have to do what we can to prevent not only stroke and heart attack, but all of these chronic diseases that we see in the United States every year. Well, how many of you have heard of the Million Hearts Initiative? We have major screenings going on with Million Hearts. I'll show you that we have a Million Hearts clinic in a little bit to focus on people with risk factors. That had a goal. Let's prevent 1 million heart attacks and strokes. Well, what's sad, what we've just learned from our data, this has declined. Stroke death has gotten worse in the past few years than better. And that is due to lack of control of high blood pressure and the increased numbers we're seeing of diabetes, obesity, and other risk factors. What's really disconcerting about the slowing down in the prevention of strokes is the age group that it's affecting more than others is the 35 to 64-year-old age group. And I will tell you, that's probably 95% of you in the room today. So it's never too early to start with prevention, including our children, our adolescents, and our college students. So major risk factors for stroke: diabetes, high cholesterol, high blood pressure, atrial fibrillation, which is common in older adults. People with AFib have a 5 times risk of having a stroke, which is why they have to be on anticoagulation medications to prevent that. But then look at these last two: behavior things, tobacco use, and physical inactivity. Sitting is literally killing us. So the National Institute for Neurological Disorders and Stroke, in combination with the Heart, Blood, and Lung Institute, the Million Hearts campaign, they started this Mind Your Risks campaign recently as an attempt to get news and evidence out there to people all throughout the United States. Know your risks and take action to do something about them. They're promoting practices, evidence-based practices for high blood pressure control, hyperlipidemia. And I want all of you to know the signs of stroke, because the earlier you get treatment, the better chance of full recovery that we have. We always say, act fast. Remember, face changes, right? One side of the face, you're having trouble speaking. So, sudden onset of weakness in your arm, in your face, or your leg, especially if it's only on one side of your body. Sudden onset of confusion, blurry vision, trouble seeing, again, on one side. versus the other. Sudden onset of trouble walking, dizziness, loss of balance, or lack of coordination. And then if somebody tells you they are having the worst severe headache that they have ever had, even with migraine sufferers, they need to be seen right away. So the earlier you get treatment within just a couple hours, there are clot-busting meds that can be given, and people have a full chance of recovery. Well, when we look at the current state of health in America, we could get depressed. But I didn't bring you here to depress you today. I brought you here to say there are things that we can be doing to prevent this from happening. 1 out of 2 people have a chronic disease in this country. Yet again, 80% of heart attacks, of strokes can be prevented. Those of us with kids, it's really sad to say this, but our kids today are really expected to have a shorter lifespan than we do today because of all of these chronic diseases. So at Ohio State, we focus on what's called modifiable risk factors. Because if we can get you just a little bit better, eating healthier, engaging in physical activity, keeping your blood pressure under control, sitting less, we have a chance of preventing these chronic diseases that plague us. So we created a fact sheet on how to preserve your brain health. Again, all of these behaviors are exactly the same if you want to prevent heart disease as well as other chronic conditions. So prevention is key. And if you haven't seen this wonderful prevention toolkit that's designed by the American Stroke Association, freely downloadable, I really encourage you, go to this website and share it with as many people as you possibly can. Brain health and healthy aging are directly related to one another. We can improve heart health, brain health with just a few healthy lifestyle behaviors. The character builder is its behavior change. So we've got to get to the point at Ohio State where these healthy behaviors are the norm here, the default choice. So you heard the data. Heart disease, the #1 killer. However, if we take into consideration all causes of death and disease in the United States, it's really our behaviors that are the #1 killer. These things right up here. And this one you have to take very seriously. Beware of your chair. How many of you have a standing desk? Okay, that's good. That's about 1/3 of you. I walked into Greg Rose's office on Lima campus, and I walk in his office. He's the dean there, and he has a standing desk made out of books and a cardboard box. And my response to him was, "Great, can't you afford a $50 metal apparatus for standing?" He said, "You know why I did this, Bern? I was so impressed with this." He said, "I did it to show my faculty and staff we don't have to buy fancy standing desks. We can makeshift these things with what we have." And I thought that was a really great exemplar. There are a lot of leaders that I work with all the time, encouraging them to buy their faculty and staff these standing apparatuses, to put walking treadmills in their units, their office settings, wherever it is. How many of you sit 3 hours a day on average? The majority of this room. So research tells us if we sit 3 hours a day, regardless of whether we exercise 150 minutes a week, we're increasing our chance for heart attack or stroke by 30%. If we sit 5 or more a day, that is comparable on our bodies, no kidding, based on research, smoking 1.25 packs of cigarettes a day. Now, some of you look surprised when I said that, but how come everybody didn't stand up? It's culture. Help me create a culture at Buckeye Nation of standing meetings, of walking meetings. Try it. The next time you go to a meeting with your colleagues, say, "Let's have a standing meeting today instead of a sitting one." In addition to it being good for your cardiac health, you'll get through the meeting a heck of a lot faster when you stand versus when you sit. And I will tell you, at our vice president and dean's meetings now, I have 50 to 60% of our leaders who stand throughout a lot of the meetings. If we can do it, you all can do it as well. Take a hard look at this slide. Do you see something weird about it? This is a real fitness facility in the state of California, and you have a choice. You can either walk the stairs or take the escalator to go work out at the gym. So a group of psychologists were fascinated with the concept of how many people in a day during a week would choose the stairs instead of the escalator. So they studied it. They're finding 2 people a day took the stairs to go work out at the gym. So think about the choices that you all make every day. When you have a choice, do you take the stairs instead of the escalator? I'm building a new building addition to our College of Nursing, and I told the architects, hide the elevator. What I want people to do as soon as they walk in is see this beautiful set of stairs. Think about that. How often do you drive around the parking lot looking for the closest place to park next to the door? Instead of, I'm going to park further away where my car won't get dented, and then I'll get my steps in for the day. So more than our genes, more than our social circumstances, more than the health care we get, it's really our behaviors that are going to determine whether we die an early death or not. Now, I love evidence-based practice. It's one of my areas of passion and expertise. And I've long had the philosophy in God we trust, but everybody else better bring data to the table. And I will tell you, when we plan interventions here at Ohio State for our Buckeye family, we're always looking at best evidence and implementing best evidence in what we do. So if I had to give each of you a simple evidence-based recipe for how to decrease your risk of all these chronic diseases, this is it. Take a photo of this slide, tweet it, share it with your colleagues and your loved ones. Because sincerely, this is research-based. This is all you need to do. 30 minutes of physical activity, 5 days a week. You might say, Bern, you're pie in the sky. I got a family, I work, I'm busy in the mornings, get my kids off to school, whatever it is. I can't do this. And I'll say, if I can do it with the crazy life that I have, you guys can do it. But I will tell you, your thinking about it maybe is a little off. Maybe you're thinking, I got to go to the gym 30 minutes, or I got to do this all at one time, 30 minutes. No, you don't. Cut your meetings down during the day. Instead of 60 minutes, do 50-minute meetings. So you have 10 minutes to recover. You could do 5 minutes of jumping jacks during the day. That would count. You could do 3 10-minute brisk walks. At the end of this presentation, I'm going to do chair aerobics with all of you because you are sitting. So I'm going to show you how we can get some heart health by sitting and doing some chair aerobics. So you can do it. 5 fruits and veggies a day. Don't smoke. If you don't drink alcohol now, don't start. If you do, you got to limit your alcohol intake. And the guidelines are no more than 1 drink a day if you're a woman, 2 a day if you're a man. Then everybody asks me, Bern, how big can that drink be? And I tell them, not the size of the alcoholic beverages we get in Vegas, not that big. These are PET scans of the brain. This is your brain after sitting quietly versus after just getting up and taking a brisk 20-minute walk. Look at this area here. Your neurons are happy. They're firing. You're more alert. Do you know that mid-morning and afternoon lull you get in, right? Where your brain kind of shuts down. You're sitting too much. You would be so much more alert and engaged. Just break up your day. Move more and sit less. We don't need more time. We need more energy with the time we have. And one way to get it, sit less and move more. But the Centers for Disease Control did a study, and what they found was disheartening. But it makes sense with all the chronic disease we have today. Only 6% of people are meeting these. That's it. So that explains 1 out of 2 people in the United States have chronic disease. Self-care. Now, I want you to tell me the truth. How many of you do a good job at prioritizing your own self-care? Okay, that's all of about 8 of you in the room. Please hear me on this. I want you to be around a super long time. The people who love you want you to be around a super long time. If you don't prioritize your self-care, you may not be around for the people who love you. I didn't have a mom to see me graduate from high school, college, go on to have my 3 beautiful daughters. So when I get up in the morning, if I don't feel like eating healthy, exercising, making sure I'm stress reducing every day during the day, I might not be around like my mom. So you got to think of it that way. When we get on a plane and the masks fall, what are we told? Put them on yourself first before you put them on your kids. So I just really encourage you to think about this super seriously, because the number one reason people don't prioritize their own self-care and they don't do the things we need to do to keep themselves healthy is the excuse of time. So let's watch this video that hopefully will get you to think a little bit more about what you do with your time.
These are roughly 28,835 jelly beans. I counted out 500 of them and used those to weigh the rest. In this pile, there's 1 jelly bean for each day that the average American will live. You might have more beans in your life, or maybe less, but on average, this is the time we have. Here's a single bean. It's your very first day. A special day, but kind of a rough day on everyone involved. Add 364 more and you have the first year of your life. Now, for a sense of scale, here are your first 15 years, 5,475 days, which brings us to the threshold of adulthood. And at that moment, this is the time that we have left. And this is, on average, what we will do with all that time. We will be asleep for a total of 8,477 days. If we're lucky, some of that time we'll be sleeping next to someone we love. We will be in the process of eating, drinking, or preparing food for 1,635 days. We'll be at work, hopefully doing something satisfying, for the equivalent of 3,202 of those days. 1,099 days will be spent commuting or traveling from one place to another, maybe a little bit more if you live in LA. On average, we will watch television in one form or another for a total of 2,676 days. Household activities, like chores and tending to our pets and shopping, will take another 1,576 days. And we will care for the needs and well-being of others, our friends and family, for 564 days. We'll spend 671 days bathing, grooming, and doing all other bathroom-related activities, and another 720 days will go to community activities like religious and civic duties, charities, and taking classes. After we remove all those beans, this is what remains. This is the time that we have left. Time for laughing, swimming, making art, going on hikes, text messages, reading, checking Facebook, playing softball, maybe even teaching yourself how to play the guitar. So what are you going to do with this time? How much of it do you think you've already used up? If you only had half of it, what would you do differently? What about half of that? How much time have you already spent worrying instead of doing something that you love? What if you just had one more day? What are you going to do today?
I think that's a great clip. It really gets you to think. So I'm going to finish by giving you a charge for today. How many of you made a New Year's resolution to get healthier in some way? Okay, a small number of you, but guess what? We're going to imagine today is January 1. And what I want you to do is I want you to pick one of those healthy lifestyle behaviors that I showed you. And I want you to make a commitment by writing it down before you leave. I, Bern Melnyk, or I, Rebecca Momini, I commit to increasing my physical activity from 10 minutes a week, twice a week, to 15 minutes twice a week. It takes 30 to 60 days to make or to break a new habit. Research has shown those people who write their goal down, put it in front of where they can see it every day, have a better chance for success. So I really want to encourage you to do that. The last thing that I am going to do with you today is chair aerobics. For those of you that love to sit, I'm going to show you how you can get some good cardiac and brain activity going. So here's what I want you to do. I just want you to follow along and do whatever I do. And by the way, this is not a test of coordination. This is to get your body moving. Even though it's February, we're going to jam to some Earth, Wind, and Fire. September. You ready? Uh-oh. Ready? We're going to march first. You look so much happier, see? We're going to work our bicep. Now triceps. Faster. You're looking good. Front, up. Now we're going to do a little disco. You look so good. Hey, triceps. You feel your heart going up a little? You feel like you have more energy. the coordination test. March it out. Great job, everybody. Give yourselves a hand. Lastly, if I couldn't motivate you enough, this little girl is going to do it. So as you leave today, write down that goal, put it in front of where you see it every day, and just do it. Thank you for coming.
Just do it. Don't let your dreams be dreams. Yesterday you said tomorrow. So just do it. Make your dreams come true. Just do it. Some people dreamers are obsessed. And you're going to wake up and we're going to work hard at it. Nothing is impossible. You should get to a point where anyone else will quit. And you're not going to stop there. No, what are you waiting for? Just do it. Just do it. Yes, you can. Just do it.
Go Bucks! Thanks for coming today.